Source is a podcast made by women for women. We're looking at the topics that are influencing women and the world they live in, and we're shedding a light on those topics. We're speaking with the national experts. We're bringing you the stories you're only going to hear here. Don't miss out on being in the know. Subscribe to Soul Source wherever you listen to podcasts today and leave us a review. This part's really important. That way we can continue to bring you the content you love each and every week. So buckle up, Soul Source Society, because we're about to get started.
We have been trained to be passive. We've been trained to think there are no other options, and we just do what our doctor and insurance tells us to do. And I want us to change the way we think.
Well, Dr. Sem, welcome to Soul Source.
Thanks for having me. Good to be here.
We're excited to be talking with you today, and I briefly mentioned some of the issues that women are facing here in our country, but I know you and I are about to get into this a whole lot more here on the show. First off, tell me a little bit about you. You're actually a biochemist as well as an author and a professor. That's a lot.
Kind of eclectic. I'm still trying to figure out what I want to do when I grow up. So I'm right now I'm dean of the School of Business at Concordia, but my background is actually in pharmaceuticals. So I have a PhD in biochemistry, and I worked in biotech for a number of years doing drug development. And then I moved to the academic world and slowly moved into business. And over the years, I've been involved in helping startups. So that's how I got it, healthcare startups. That's how I got into business. But I've broadened my interest the last 5 years into healthcare policy.
I was going to ask you, how did you get into the healthcare system and comparing healthcare systems across the globe?
Yeah, I mean, I got interested in the high cost of drugs and how to address unmet medical needs through therapeutics, but I broadened my interest, in my role in business to consider what I think are sort of the bigger problems in healthcare. Of course, we need new medicines, but we just don't have very good, affordable access to healthcare in the U.S. And it's very frustrating because, at the technical scientific level, we have some of the best healthcare in the world, but it's just not functioning well. So for the last 5 years, I've been diving deeper into that. And I started a think tank called the Rx ThinkTank, focused on exploring these policy issues and basically how to fix healthcare in America. And I've had probably over 100 thought leaders in this area. And based on what I hear them saying, I've written a book to sort of summarize what I think are some pretty obvious solutions to fix healthcare.
And to that point, the book, I mean, I've got it here. It's Purple Solutions. I actually read it. I know one of the findings of this extensive research that you've done is the cost of healthcare in the U.S. It kind of breaks the bank in many cases. Why are these costs so expensive here in the United States?
Yeah, it's just not sustainable, really. I think, is healthcare at a tipping point? I would say it's at a breaking point, right? In the US, we spend 18% of GDP on healthcare. We spend on average over $10,000 per family, per person on healthcare. I think it's the reason why we have wage stagnation in the US is because what employers could have paid us in a raise is going to our healthcare. It's just horrible. And in a nutshell, and I could probably talk for a long time on this, but I think it's just the way it's structured. It's really the worst of both worlds. It's not what the Republicans want. It's not what the Democrats want. It's a highly dysfunctional system that almost is designed to escalate prices. So for example, maybe if you had universal health care, you could have some way to control it. That's not what I'm advocating for, but that would be better than what we have. From the flip side, we don't have anything like a functioning market in business the way we think of that. So you as a healthcare consumer going to the doctor, you have absolutely no idea how much things cost. And, that used to not be an issue, but nowadays you end up getting a surprise bill for $1,000. And that is a serious problem. And the way things work is the cost of something, or maybe price is the better word, is not really figured out until it's all done and you get a bill. And what we have is a reimbursement driven system so that the hospital, the provider for us, is supposed to get their money from our insurance company. So they negotiate prices. And those prices actually, believe it or not, are inflated beyond what they really should be. And I would say they're not exactly complicit because I think there's a sort of adversarial relationship between the insurers and the provider. They keep negotiating and pushing, but hospitals have a whole bunch of overhead costs that gets folded into their prices. And as long as they can negotiate the insurance companies to pay it, they'll pay it. And then the insurance companies ultimately just charge us more. So the whole system has no checks and balances, and the price just keeps rising. And we just keep having to pay more, because really the insurance company, you'd think they care that things are expensive, but they don't actually care, because they're just going to make us pay more for insurance. And if you ask any employer, insurance premiums have constantly been going up over the years. Whereas if we knew what things cost, we could recognize that so-and-so is charging an inflated price, but another is not. And we would go for the one that's not charging the inflated price.
Oh, it's like a consumer's flying blind almost. It's hard not to get mad when you hear that.
Yeah, I am mad.
I mean, it is. It's just like, oh my goodness. So, you've been studying this. That's how the U.S.'s healthcare system operates. How does it stack up to those in other countries?
So other countries take sort of a range of approaches. So we hear a lot of talk about Canada. So Canada is maybe on sort of one extreme. So they have universal healthcare and nobody has to worry about paying for it. It's all covered. So that's a nice thing, of course, in people's minds. The trouble is the price, the cost actually does escalate, and it has to be paid for by the consumer. And eventually it leads to some sort of rationing, but I don't want to overstate that, because Canada has pretty good healthcare. But 65,000 people a year in Canada leave the country to get their health care because they don't want to wait months for hip surgery or an MRI, which they could get in the US in a week or two. So there is a lot of migration out of Canada because they only have universal. UK has something close to that, but Switzerland and Germany have sort of a hybrid system where, yes, they have something kind of universal that's using private markets, but they also let you purchase things outside of the system, which Canada does not allow that. I would propose us to have something sort of hybrid like Germany or Switzerland. Now, Singapore in the extreme actually has really good healthcare. It only costs them as a society 2.5% of GDP versus 18% for us. And they let you have an HSA account, and some of that money comes from the government, and then you can purchase through that HSA. So it actually creates something like a market combined with universal care. So that's sort of what I'm advocating. I'm not advocating for the Canadian system per se. I'm more for sort of these hybrid type systems. But no matter what, almost anything is better than what we have.
Well, hence the name Purple Solutions, right? It is literally, you've got blue Democrats, you got red Republicans. It's a hybrid in the middle. So it totally makes sense. Okay, so Soul Source is a show. It's made by women for women. We talk about women's issues, things that are impacting women in the world today. So naturally, we're talking about women's health with this segment because we're talking about healthcare. How are current events impacting women? That being said, how is the U.S. healthcare system stacking the odds against women here in the United States?
Yeah, I think there's probably a few ways you could think of. For one thing, women on average outlive men, so they need healthcare longer, and we end up spending the most on healthcare towards the end of our lives. Women are actually twice as likely as men to suffer from dementia and Alzheimer's disease, and so they're going to need that very expensive care. I also think I'm interested. The other part of my eclectic background is pharmaceutical drug development, and we're working on a drug right now to treat symptoms of menopause. And we've interviewed menopausal women and OBGYNs and discovered that really the needs of women in menopause, what they're suffering through, is really not being addressed at all. There's really, it's almost sort of minimized sort of the challenges of hot flashes and other symptoms associated with menopause. So there's a great need for better treatment for those symptoms, and women's health issues in general don't, I would say, get enough attention as well.
Well, and we talked about this a little bit before, and I thought it was really interesting. You said something about the medical system being paternalistic. Explain what you meant to me by that.
Yeah, that I think is really a serious problem, and that's sort of, it goes back to the history of medicine in general, where the sort of approach is the doctor is the sage, and you should trust the doctor and you shouldn't question them. They're sort of all knowing, definitely paternalistic. Just, don't ask. These are complicated things. Trust me, I'll take good care of you. That's sort of the approach to medicine. And that's what we think of with the whole concept of paternalism. And definitely male doctors tend to do that. And I know my wife has frustrations even bringing up personal issues with her doctor, and sometimes she likes to think of blending, traditional, Western medicine with nutraceuticals and things like that, and it's just it's minimized on an almost a condescending kind of way. But the bigger picture of paternalistic medicine that I think is a problem is we live in a society now where young people are more and more empowered. I mean, you can buy a car, you can buy a home online, you can do your own research. I remember when I was younger using travel agents. People hardly ever use travel agents. I think
It's been replaced.
We should be able to take care of our healthcare, more. We should be more involved. We should be more actively involved. Nowadays, if you approach your doctor with information that you have, they tend, especially the older doctors, tend to kind of blow you off. Like, yes, you can't trust what's out there. They don't say this, but you don't really know. This is complicated. Just trust me. And I think the future of medicine with telemedicine and us even being empowered to get our own diagnostic tests done, if you want a thyroid test done or something like that, you can do that yourself. I think we're moving to an age where we are going to be much more in control of our healthcare. That requires medicine to be listening to patients. It should be a partnership between the doctor and the patient. So we have to move away from paternalism for sure.
Well, and to that point too, I mean, when I think paternal, I think more male dominance, right? And so I mean, this is my analogy in my brain. Tell me if I'm wrong, but like I think when you go to a car dealer, right? Like a woman going to a car dealer, a pretty good chance she'll get swindled, right? We all kind of know that. We usually bring a guy with us to try to help negotiate car prices and all of that, just because, I don't know, that's just kind of how that world works. Is it kind of the same thing in medicine? Are women kind of looked on as like, we don't know what we're talking about when we talk healthcare?
I mean, medicine in general treats both men and women that way too much, but I think more so women are treated that way, and it's a shame. It's, in general, we need to move away from that approach in medicine. We need to be empowering consumers, and oftentimes it's the woman in the household who's making the healthcare decisions. So we need to empower consumers, and if it's a female consumer, that's more often the case than not. So I think there's a hesitancy to move in that direction because obviously medicine was a male-dominated field years ago, and it's evolved away from that, fortunately. But it still has that paternalistic philosophy that I think is changing, but not fast enough, and definitely not fast enough for what I think healthcare is evolving into, which is a consumer-driven world where we're empowered. We should have our own medical records. We should be letting hospitals have access to our records. We shouldn't have to ask them, hey, could I have my medical records, which I do own, but it's difficult. And they're like, well, why do you need them? Are you going somewhere else? What do you need? It shouldn't be that way. We should be empowered, and for sure women especially.
Absolutely. And you alluded to my next question. So that was perfect, because I was going to say women tend to make a bulk of the healthcare decisions in the family for usually the kids themselves. It just tends to be the role that the woman takes on most of the time. Why then is it so important for healthcare costs to positively impact and benefit women if we're making those decisions?
Yeah, well, like you say, they're sort of the CEO of the healthcare for the family a lot of times. And so they need to be treated that way with respect and empowerment. And there are the tools out there to be empowered and to research and to make informed decisions. So the physician has to treat that like a partnership with mutual respect, especially like you say, when more often it is the case that it's the woman making the decision for the family. So I think, and I'm all for women in that position feeling empowered. You should feel empowered. You should push back if you're getting resistance, because a lot of times there is good information that you can get access to. Of course, the last few years we're sort of struggling with what's real and what's not real, but there are reliable sources like the CDC, the FDA, NIH, things like that, and databases. We even have access to our own genetic information, 23andMe and others that through other tools, you can find actionable information that you can use for controlling your diet and your healthcare. That should all be under our control, and our doctors should respect us in that way and treat us as a partner. And many do, but not enough.
Absolutely.
In my experience, it tends to be the younger doctors.
Yes. Yeah, I would agree with you. It's younger doctors. I find female doctors, women to women, seems to also kind of go that way, which is kind of nice. But yeah, there's definitely a divide there. So the women, we bear the children. We oftentimes have the contraceptive costs throughout life. Menopause-related health issues, which I know you are also focusing on and working on to contend with as we get older. So do you feel that the healthcare system here in the United States, is it helping women receive care or making it harder just because of costs on these sorts of things? That it's just literally life. You know, we can't avoid these things that happen to us, but does the healthcare system work to our benefit or not so much?
In some cases, not so much. I mean, we already talked a little bit about the dealing with what can be really kind of difficult symptoms of menopause are almost minimized and ignored. Most we interviewed OBGYNs, they don't have much to recommend for somebody who's suffering through hot flashes. And so you're left to try to figure it out on your own, which is getting to the empowerment. You should, research those things, and your doctor actually should be a partner with you. Sometimes things aren't covered. So for instance, I think some faith-based institutions won't cover contraceptives, and I'm not criticizing that per se, but it kind of opens up the whole question about where do you go if you have pharmaceutical needs that are not being satisfied by your insurance. And I think that because of this paternalism in medicine, we have been trained to be passive. We've been trained to think there are no other options, and we just do what our doctor and insurance tells us to do. And I want us to change the way we think, because you can do other things. I mean, one really simple thing that I bet a lot of your listeners know about, I hope, is GoodRx. You can search on GoodRx for medicines that are going to be way less expensive than if you use your insurance. So for instance, my daughter takes medicine for depression, and if we went through our insurance, it was going to cost her and us $150, and we found it on GoodRx for $25. So
unbelievable.
Well, use our insurance, and I'll send you the $25 if you want.
Yeah, that's crazy. That's crazy. It's so inflated on insurance, and you can, like you said, you can just get something for $25. Okay, so I have to ask, because I'm curious, why? Why does that happen? Why is that the case?
Because, I mean, and in pharmaceuticals, it's almost, there are other sort of complications, but it's sort of the same thing, that there are hidden expenses and overhead built in that you shouldn't have to pay for. So I mean, in pharmaceuticals, it gets to sort of the lack of transparency between the pharmaceutical company and you at the pharmacy. There are pharmacy benefit managers in between, and they sometimes, many are very ethical, but oftentimes they game the price. So they get a discount from the pharmaceutical company that they're supposed to pass on to you, and they say they're passing it on, but they're only passing on a fraction of it. So there have been cases that have been discovered across the country now of massive price, arbitrage like that have shot up the prices of pharmaceuticals. It's been on front pages of the Wall Street Journal and others, tens, hundreds of millions of dollars in Ohio and other places. But in terms of hospitals, so for example, hospitals are required by the EMTALA regulations. I can't remember what the acronym stands for.
Okay.
But it came under the Reagan administration that said hospitals cannot turn people away from emergency rooms. So there you have it. We have universal health care. It's in an emergency room.
Where the cost is crazy high.
Yeah. So they got to cover that cost. So who pays for it? Well, you pay for it. So they got to cover it somehow. It's their overhead. And they have other kinds of overhead. The administrative staff in hospitals has grown so much more hiring of administrators than physicians and nurses and so on in big hospitals. And buildings, I would say hospitals are way overbuilding in terms of physical space. And if you visit a hospital, it's like an art museum. It's a beautiful building. All of that quote unquote overhead, you're paying for. So that's just their cost. So if you went to a small physician group that can provide just as good a care, but they don't have such a beautiful building. They don't have all that administrative staff. And, we have to get at the whole emergency room issue, but they don't have that. So you can get, for example, people surveyed prices of MRIs. So a big provider would typically charge around $3,000, but you can get a really good MRI of equal quality for $500 to $700. But you're not told that. So you just have your insurance, and your doctor, who's not aware of this, says, well, use our MRI because it's in our system and it's easier. Okay, so now you're being charged $3,000 instead of $700. You don't really care unless you have to pay for it. So now that we have high deductibles and copays, we are actually having to pay what I would call these inflated made up prices.
Mm-hmm.
So that's why I say we're at a breaking point now, because in the past, you didn't have to pay for it. So you didn't really care. So the prices just kept going up and up and up, and your insurance kept going up and up and up. And you never knew it because your employer was the one paying it. So, but now you're having to pay it. So I would almost say, don't use insurance unless it's for something very expensive, like a surgery or something like that. Routine doctor visits should cost $50 to $100, but you have to pay much more than that when you use insurance because you're paying for the overhead. So
I'm currently pregnant. I'm about 7 months pregnant right now, and I was looking at ultrasounds. And the ultrasound I had at the hospital was $1,000, and so I asked about getting another one, and they were like, "Well, we can't give you another one unless there's a medical reason." Well, I was like, "Okay, fine." But then I started Googling, and I found I could get an ultrasound done at an ultrasound clinic, read by a tech. It was like $200 versus the $1,000 that it was at the hospital. I'm like, holy cow.
Yeah, and and I don't blame doctors because they're not aware of this. The doctors, I think, truly care about their patients, and the nurses. I wish they knew that, because you want this ultrasound. You should be able to have it. Why shouldn't you have it if it's only $200? Your doctor should be able to refer you for that, but the doctor doesn't know. Doctors are penalized if they refer out. There's something called leakage, where in the software it detects that they refer out, and that's a problem. I think that's anti-competitive, and it's not leading to the best interests of the patient, like in your situation.
Yeah, it's definitely interesting. I get to see, so this is a whole different rabbit hole, but I'm just going to mention this quick, is I get to see a little bit of a different angle of things because I'm able to go out to the Oneida Tribal Clinic. So I'm working with the Native American tribe for healthcare a lot of times. They do a lot of referring out because it's a clinic. So when there's, you need some sort of special procedure or something, you're referred out often. But I do see that that's completely not the case in traditional medicine. And it's very interesting to see the differences just between a tribal clinic and regular healthcare.
Yeah, because it doesn't have that big dysfunctional bureaucracy built up around it.
It's a totally different system. Yeah. So is it possible for the United States then to implement a better healthcare system that's more cost effective? What would have to happen to make that happen here?
Yeah, I think there's a few things. I really do think we need to empower us as healthcare consumers. We should be able to have this information, and we should be able to act on it. You should have been able to know that there was a $200 ultrasound, and it should have been easy as pie for you to do that. Mm-hmm. Right now, it's sort of flipped. You need the permission of your doctor and the permission of your health insurance. So we need to have patient ownership of medical records. So it's actually you have access to it and you give others. And then we also need to have price transparency. So on the Republican end of the spectrum, the Trump administration had passed executive orders that required providers to let you know how much things cost up front. So there's no more surprise billing. That should be a bipartisan thing, and I think it was. There are a lot of challenges that we're talking about now with the Trump administration, obviously. But because of that, I hope it doesn't get lost in the mix of things, that in particular was a good thing. Part of the reason it's good is the American Hospital Association sued to prevent it from happening, and they lost in the courts. So they're being forced to be price transparent. And you know what they're doing? They're deciding still not to do it, and they're going to pay the penalty for not being price transparent instead. So they're fighting, empowering consumers. So that's on the empowering us, letting us shop, which feels like a Republican concept, which, further down that road, I say we should have an HSA with money in it where we're allowed to shop. So, which, if you're more from the Democratic end of things, you might say, well, maybe the government could provide that money like in Singapore, or whether you provide or both. On the Democratic end of things, I do think we need something universal, some kind of baseline good healthcare for everybody. But unlike Canada and the UK, we should allow people to buy additional levels or to shop outside of it. So some sort of hybrid thing where there's price transparency, money we can spend in our HSAs wherever we want. We have our medical records, so we go wherever we want, whenever we want. So empowering the consumer. But that alone feels, from the Democratic end, you might say, well, healthcare isn't like grocery shopping. It's not just a matter of empowering a consumer. So the complement to that, I would say, is something universal with good baseline care for everybody that they can add to if they want. And that would kind of alleviate the overusage of emergency rooms for things that they shouldn't be useful. For example, maybe you're a common situation you might be a single mom, you're working long hours, and you don't have the flexibility with your job to take your child to the doctor during the day. So your only choice, and maybe you don't even have insurance, so maybe your only choice is to take them in at 9 o'clock at night to an emergency room. It shouldn't be that way. There should be some other alternative to that, which if we had some baseline universal care, and importantly, broader implementation of telehealth so that you can get to a doctor at 9, 10 o'clock at night and solve these problems. That's what we need. And that's implementable, I think. So.
Well, yeah. And we've seen the importance of telehealth this last year. I mean, it's become very popular. Could definitely help out that single mom who just has, crazy hours and no time.
Exactly. Yeah. You do whatever you have to do to take care of your kids. So, and telehealth was restricted a little bit by our medical bureaucracy, which, by the way, the former president of the AMA, who wrote a chapter in my book, calls the medical industrial complex, which is, I think, sort of an anti-competitive industry. I think telehealth was too cumbersome to use before COVID. COVID's a horrible thing, but one thing COVID did do is it introduced us to telehealth, and it made it easier to do. So HIPAA regulations, which protect our privacy, are a good thing, but they really restricted us from being able to talk to our doctor over Zoom or an app. And now that's been loosened a little bit. A lot of times your doctor might be in another state. That was prohibited by law during COVID. That was loosened so that you could have access to doctors wherever. So telehealth has become much more prevalent during COVID. And I talked to a lot of providers, both Republican and Democrat. They're happy that the regulations on telehealth were loosened. Both sides are happy. So I hope that stays after COVID, because I think telehealth is a great thing. It's not a panacea. You still need face-to-face sometimes with your doctor, but I think it's part of the future of healthcare.
Oh, for sure. And to that point, if that's one thing lawmakers agreed on, what is the overall role that they play in changing the healthcare system? It's a big one.
Yeah, it is a big one. Yeah. Well, I mean, some of it is just, in the middle. So a Republican might say, well, massive deregulation. Well, let's just have smarter regulation. Maybe we can loosen some regulations like we talked around telehealth. So that is something, is rethink the regulations that we have. Some of the regulations, and I have a chapter in my book on quality in healthcare, where physicians say, if you're regulating from DC everything that a physician is doing, medicine changes every year, monthly. So it's hard if you have too many quality metrics that are tying the hands of doctors, and yet you need to have a balance. So smarter regulations. Here's a big one, though, is I think the medical industrial complex is highly anti-competitive, and we need to recognize that, and we need to break it up. There need to be better enforcement of antitrust laws. You look across the country, and there's a constant trend towards mergers of healthcare providers, and small physician groups, which I argue are providing better care at lower cost, are being squeezed out. And the president of the AMA, the former president of the AMA, Barbara McInerney, she was suing the providers in her state of New Mexico for anti-competitive behavior for squeezing out physician groups. So I don't think we need this big, monstrous healthcare entity. I think we need to have smaller physician groups empowered and so on. So better enforcement of antitrust laws for sure. And then just, and I don't expect it'll happen for at least 6 months, but Republicans and Democrats to talk to each other again
Hmm.
and to have some sort of intelligent compromise. On the Biden end of things with the Affordable Care Act, I know Joe Biden is proposing to have sort of a public option, which would be that baseline option. So that is sort of the tiered approach I'm talking about, like Germany and Switzerland has. So I think that's a good thing, and that's a democratic platform. But I also think that we should embrace what the Republicans were proposing, which is, more freedom in terms of how you use your HSA, price transparency, allow us to shop. Because I truly think that probably more than half the time, we'd be smarter to not use our insurance, whether it's the ACA or our work insurance. And we're just not able to do that. We're trained to be passive in a paternalistic medical industrial complex. So, and I don't think young people want to be passive. They want to do everything on their phone. So,
Yeah, yeah. I mean, I hate the idea of having to look at all of the people who are prescribed by my insurance, and I can't tell you how many times my dad insurance has changed over at his company, and he has a doctor, and now he's got to find another doctor. He's got to find another doctor because his insurance has changed how many times, and it frustrates him. And frankly, it sucks, right? Like, it sucks having to leave your doctor just because insurance doesn't cover it.
yeah, I mean, you can, just in terms of primary care, which is like 80% of all we ever need,
Hmm.
you can subscribe to a doctor network, direct primary care for maybe $75 a month. And you get 24/7 access to a doctor, which you don't have right now with your insurance. For a whole year, that's less than one emergency room visit. I
Wow.
think put some money in the HSA. If presidential candidate Yang wanted to give us all sort of a universal baseline income, put $1,000 in an HSA account and say that's for getting your direct primary care. So now the whole country has 24/7 access to their doctor and small physician groups, which is going to take care of almost everything you need. And I talk to these direct primary care doctors. They'll do, they have partnerships with imaging like MRI scan or
Mhm.
lab tests. They'll say, look, if we go through the provider network, it's going to cost $200 for this test. If I do it for you directly, it's $25. So we just need to be able to empower us to do that. Give us a membership in a physician group. You're going to get better care. And of course, the American Hospital Association and the medical industrial complex is going to try and prevent you from doing that. But we need to break that up. So
Yeah. So, in your opinion, healthcare system, if it stays the way it is, what does it look like in 10, 20 years? Can it even make it that long?
if it stayed exactly the way it is, no, because I think right now we're paying maybe $2,000 deductible copays in a given year. People can't afford that. It's breaking people. People are just going to go without insurance. So it just doesn't work right now. It's not sustainable. It's not fair to ask the American public to do that. And they're upset. And one of the things they're upset about are these quote unquote surprise medical bills. But that's a lot of times that's because you're paying these inflated prices and so on. So I think it has to change. I can't imagine it staying this way for more than 2 years because it's just such a financial drain on people. So I would predict that the Biden administration will have some success with some kind of public option. But what might happen is that it's still going to be too expensive. I don't know if it's going to be universally covered or not. Ideally, it would be universally covered, but maybe it's not going to have everything you want. So therefore, we're still going to have to be spending our own money. So therefore, we should implement this kind of consumerization I talked about, so that when you got to pay for your own scan that you talked about, you should be able to pay $200 instead of $1,200.
Hmm.
And the only reason you're not doing it is because you didn't know where to shop to find it, and nobody was telling you the prices anyway. So
Right. It's like the information's out there, but you have to dig and research. And honestly, how many people actually do that, you know? And what's even more sad too is like not only people not going for insurance, but I mean, I know some people who they don't go to the doctor, right? There's something wrong, but they're not going to go because they know there's going to be this cost. And they're like, well, I can't afford that. So it's sad people don't go get health care that they need.
yeah, and I think if we let a market react to that, if you could know that a doctor could take care of me for $75, you would do that. The trouble. So I think it's positioned for change. We're being asked to pay more than we can afford, but nobody's given us other options. As soon as we actually see that there are other options, we'll use them. So
Yeah,
we're experiencing the pain, but we don't have any solution. But there are solutions that could exist.
There are solutions, and they're in the book called Purple Solutions. So it talks about these topics that we discussed in a lot more detail. But why would you recommend people read this book? What do they learn from it? Where can they get it?
So I'll start with where they can get it. It's on Amazon. I think it's in Barnes and Nobles and other bookstores, but Amazon for sure. Just search Purple Solutions book and it comes up.
Okay.
I think we need to be informed voters for one thing. So you can see that there is some value on both sides of the political aisle. So you can make more intelligent voting decisions. Our politicians only respond to us and the lobby groups, and we'd rather have them respond to us than the lobby groups. And the other thing is the solutions that I'm talking about, they're out there. So I list some resources in the book where you can find direct primary care and things like that. So you can start acting on this now. And I'll tell you this, if the hospitals don't want to give you price transparency, you should be mad as a consumer. You should push on that. We should shine a light on the fact that they're trying to be anti-competitive. They would rather pay a penalty than let us know how much things cost.
Which let me just spell this out for people. If the hospitals would rather pay a penalty, that is fees that then trickle down to us as consumers. We're paying the penalty because they don't want to tell us what things cost, right?
Exactly, yeah.
Ugh.
Don't put up with it.
No. So, and for everybody out there, I mean, I've read some of Purple Solutions, and so I can definitely speak to the fact that it's highly, highly interesting. And it's also like, if you're worried about it being like a dry read or very textbook-like, it is not. It's actually pretty intuitive, pretty easy to read, pretty easy to understand. So you did a great job of just making it easy for the lame person, who doesn't have the big medical background to understand what's going on.
Yeah, thank you. Appreciate that.
Yeah, so
there's little summary chapters too. If you don't want to read the whole book, you can just read the summary chapters.
This is true. You can get the cliff notes on it. So, Dr. Sem, thank you. I can't say thank you enough for being here, sharing this with us. This is such an important topic, influencing women, but people in general, because healthcare affects all of us. So thank you so much.
Absolutely. Thanks for having me. I enjoyed it.
Thank you for listening. And if you want to hear more Soul Source, subscribe to the show. We're available wherever you listen to podcasts. And if there's something you want us to talk about, we can do that too. We have a page. It's on Facebook. It's called the Soul Source Society. And it's where we interact with listeners. We get content ideas for future shows. We talk about past content. And overall, we just have a lot of fun. That's Soul Source Society on Facebook. We hope to see you there. Soul Source is brought to you by Red Shoes, Inc., a leading agency that specializes in crisis and strategic communications, media relations, social media, and so much more. To learn more about Soul Source and Red Shoes, visit us at redshoesinc.com.